Do your ankles swell so much you can barely bend your foot? I'm not talking about that little puffiness you get after a long plane ride. I mean legs that feel like heavy stones, skin stretched tight, and those deep, lingering indentations your socks leave behind, known as pitting edema. Is that the reality you face every evening? Listen closely, because that severe fluid buildup isn't just an uncomfortable annoyance. Welcome back to our channel, and if you want to reclaim your mobility, please like this video and subscribe to our channel right now to support our mission of bringing you life-saving health information. That swelling is a bright red warning sign that your vascular system is struggling to function. When fluid pools stubbornly in your lower legs, it means gravity is winning the fight against your body, slowing your blood flow to a dangerous crawl. This sluggish circulation is technically called venous stasis, and it creates the perfect environment for dangerous, potentially life-threatening blood clots, known as deep vein thrombosis, or DVT. You must understand that this is fundamentally a critical issue of circulatory health, not just a cosmetic one. You have likely tried every standard piece of advice, such as elevating your legs on a stack of pillows, soaking your feet in salts, or severely cutting the salt from your diet, and yet the swelling persists night after night. Why does this happen? It is because you are only treating the visible symptom. You are missing the fundamental nighttime protocol that doesn't just manage the fluid, but actively and forcefully reverses the process while you sleep. I am giving you the definitive 7-step bedtime vascular fix. We are going to systematically detoxify, strengthen, and manually pump the fluid out of your legs before your head even hits the pillow. We start immediately with the internal groundwork. The standard advice to simply eat less sodium is often inadequate because edema is frequently caused by a catastrophic imbalance among your primary electrolytes, sodium, potassium, and magnesium. Your kidneys, which are responsible for managing the vast majority of your body's fluid balance, require a precise ratio of these minerals to function correctly. When you are deficient in potassium or magnesium, your cells cling desperately to sodium and consequently to water, leading to that pressurized pooling we see as swelling. Therefore, we are executing a cellular pre-sleep flush. 60 minutes before your target bedtime, you need to execute the first step, which requires magnesium and potassium. First, we use magnesium citrate. This is a natural smooth muscle relaxer that helps ease the tension in your blood vessel walls, the very veins we are trying to clear, and aids in proper cellular hydration. I recommend 1 full teaspoon, which is about 300 to 400 milligrams of elemental magnesium mixed into 12 ounces of water. The secret weapon here is potassium bitartrate, commonly known as cream of tartar. Potassium is the primary regulator of fluid inside your cells, working directly against sodium, which operates outside the cell. By boosting potassium, you signal your cells to let go of excess sodium and water. Add a generous pinch, about 1/4 of a teaspoon of cream of tartar, to your magnesium drink. Drink this mixture slowly, 60 minutes before you intend to sleep. This timing is critical because it gives your kidneys and vascular system a head start, initiating the gentle systemic fluid release before you lie down and gravity stops assisting you. If you have any underlying kidney condition, you must consult your physician before significantly altering your potassium or magnesium intake. Your body is now internally primed with the electrolyte flush, but we must acknowledge a harsh reality. That internal preparation, while vital, is simply not enough to counter the physical stress of chronic swelling. We need to take aggressive action to physically shock those veins into submission. You must understand what is happening inside your legs right now. When blood is allowed to pool in your ankles day after day, your veins basically become lazy. They become distended, stretching out, and losing the necessary muscle tone required to push blood back up against the relentless force of gravity. To fix this, we are going to force a natural, powerful vascular pump to activate through a process called thermal shock. This physiological reaction is known scientifically as the hunting response. This mechanism causes a rapid, intense cycle of contraction and release within the blood vessels, effectively waking them up and forcing them to work. This requires the contrast bath method, specifically adapted for this pre-sleep protocol. You will need to prepare 2 separate basins to execute this correctly. Fill the first basin with water that is as warm as you can comfortably tolerate. Fill the second basin with the coldest tap water you can get. However, tap water alone is not sufficient. You must add 5 to 6 trays of ice cubes to this second basin to ensure the water is painfully cold. The temperature difference is the key to the entire operation. The protocol is simple, but it requires mental fortitude. First, immerse both of your feet into the hot water for exactly 3 minutes. As you sit there, this heat causes massive vasodilation. Your veins open wide, expanding significantly. This process brings the stagnant blood and the trapped fluid from deep within the tissue closer to the surface of the skin. You are preparing the fluid for evacuation. Now comes the critical moment. After 3 minutes, immediately switch your feet to the ice water bath for a full 60 seconds. This is the hard part, so you must breathe deeply to get through it. The shock of the intense cold triggers powerful vasoconstriction. The veins instantly clamp down with force. Imagine your veins acting like a tube of toothpaste being squeezed. This clamping action forcibly squeezes the blood and the trapped fluid out of the lower leg area and pushes it back into the central circulatory system. You are not done yet. You must repeat this entire cycle 3 times to create a pumping rhythm. Soak for 3 minutes in the hot water, then plunge for 1 minute in the cold water. Return to the hot water for 3 minutes, then back to the cold for 1 minute. Finally, you must finish with a final 1 minute in the cold water. The immediate benefit of ending on this final cold plunge is immense. When you finally remove your feet from the freezing water, the skin immediately starts to warm up. This reaction causes a massive reflexive opening of the veins, known as a flush. This creates a powerful suction effect within your circulatory system. It draws fresh, oxygenated blood down into the lower legs, while simultaneously carrying all the metabolic waste and pooled fluid away from your ankles. This is, without question, the single fastest way to manually decongest your lower legs before you climb into bed. We have successfully flushed the system with electrolytes, and we have physically shocked the veins with thermal therapy, but we must now confront the fact that gravity remains a constant, relentless enemy in your battle against swelling. You might think that simply lying down and propping your legs passively on a pillow is enough, but you need to understand that this passive process is incredibly slow and inefficient for severe edema. To truly move that stubborn, trapped fluid out of your lower extremities, you need to introduce a dynamic element to your routine. You need to actively engage the powerful muscles in your calves, which are often referred to in medical terms as your second heart. This designation is not a metaphor. These muscles are designed to squeeze the deep veins that run through them, forcing blood back up to the chest. This mechanism is the very essence of the muscle pump, and without it, fluid simply sits stagnant. To activate this pump, we will utilize a technique based on the restorative yoga pose known as Viparita Karani, which translates to legs up the wall. You must execute this position with precision. Begin by lying flat on your back near a wall. You must scoot your hips as close to the wall as physically possible to ensure the correct angle. Once you are in position, swing your legs straight up so that your heels rest firmly against the wall, forming a perfect letter L shape with your body. This specific position places your lower legs directly above your heart, finally allowing gravity to assist you rather than fight against you. However, simply lying in this inverted position is not enough. Here is the critical refinement that makes this technique effective. You cannot just rest there passively. Every 60 seconds, you must perform a deliberate, active ankle flex to trigger the pump. First, point your toes strongly toward the ceiling and hold this position for a count of 5. This action provides the necessary stretch. Immediately following this, you must strongly flex your feet, pulling your toes back toward your head, again holding for a count of 5. It is this powerful muscle contraction that actively squeezes the venous reservoir deep inside your calves. You must repeat this point and flex cycle 10 times per minute for a total duration of 5 minutes. This process is known as active gravitational drainage. The combination of this active pumping with the inverted position creates the maximum possible pressure gradient. This gradient forcefully pushes the fluid from the reservoirs in your ankles up into the larger veins in your thigh and pelvis, where the main circulatory system can finally and effectively manage it. Performing just 5 minutes of this protocol is equivalent to receiving a deep, active, lymphatic drainage massage for your entire lower body. You must make this 5 minutes a non-negotiable part of your routine every single night. We have drained the fluid, now we must strengthen the plumbing. Why does the fluid leak out of your blood vessels in the first place? It is because the walls of your smallest vessels, the capillaries, become weak, porous, and leaky due to inflammation and free radical damage. We need a topical agent that can tighten and tone these leaky vessels. We are going beyond simple moisturizer and using concentrated botanical venotonics mixed with a carrier oil. First, cypress essential oil is highly regarded for its venotonic properties, helping to reduce blood vessel permeability and strengthen capillary walls. This is the structural fix of the rub. You need 5 drops. Second, rosemary essential oil is a potent circulator. It stimulates local blood flow, ensuring that the fluid we just forced out is rapidly carried away, preventing it from immediately resettling. You need 5 drops of rosemary oil. Mix the 10 drops total with 1 tablespoon of a carrier oil like fractionated coconut or almond oil. This is not a quick slather, it is a targeted massage. Sit comfortably and extend your legs. Starting with a small amount of the oil blend at your toes, use firm upward strokes to massage the oil deeply into your feet, working toward your ankles and then up your calves. Crucially, always massage toward your heart. You are manually assisting the venous return. Spend extra time on the lower half of your calves and stop the massage just below the knee pit. The veins are toned and the fluid is drained. Now, we must protect that work all night long. Step 5 involves compression. But if you are using the wrong kind, you could be strangling your circulation. If you have been prescribed 20 to 30 millimeters of mercury compression stockings for daytime use, that is appropriate for the day. However, you should never sleep in high-grade compression. When you lie down, your blood pressure equalizes, and those heavy stockings can dangerously restrict your flow, creating a tourniquet effect overnight. We need a therapeutic maintenance level. The secret is low-grade therapeutic compression, typically found in light travel or flight socks. Look for socks rated 8 to 15 millimeters of mercury. This is the perfect pressure level to maintain the reduction in edema we have achieved with the prior steps without restricting flow while you are horizontal. These socks act as a constant, gentle squeeze, preventing the tissue space from expanding and reabsorbing fluid that your kidneys are still processing overnight. Ankle or calf height is sufficient. Most importantly, check the top band. If the elastic band creates a visible deep indentation in your skin, it is too tight for nighttime use and is acting as a dangerous ligature. Roll the band down or switch to a more relaxed pair. Put them on immediately after your oil rub, locking in the fluid reduction. We are 5 steps in and you are nearly ready for bed. But before you get comfortable, you need to realize that one of your most common evening habits, the way you hydrate, is sabotaging your entire effort. When you drink water, it does not instantly leave your body. It is filtered by your kidneys, and this process takes time. Your body is also less efficient at moving large volumes of fluid when you are lying flat. Chugging water right before bed guarantees that fluid will simply settle via gravity in your lowest extremities. You need a strict 3-hour fluid fast before your designated lights out time. If you plan to be asleep by 10 post-meridiem, your last substantial sip of water should be no later than 7 post-meridiem. This means stopping the large glass of water, the herbal tea, or any other drink. The only exception is a small sip to swallow your supplements for step 7. By implementing this cutoff, you give your kidneys a full 3 hours to perform their final fluid regulation pass while you are still mostly upright. This ensures the maximum amount of excess fluid is processed and eliminated before you enter the horizontal state where gravity works against venous return. We are ready for the internal systemic repair. Everything we have done so far has been about drainage and physical tone, but the root cause of chronic edema is often chronic venous insufficiency, meaning your capillary walls are leaking. We need a pharmaceutical-grade natural supplement that can repair this damage. This 2-part combination is the most scientifically backed natural therapy for chronic venous insufficiency and edema. First, we use horse chestnut seed extract, or HCSE. This is the clinical powerhouse, HCSE, contains a compound called esin, which has been shown to significantly seal the capillary walls, reducing their permeability or leakiness. It also promotes the release of prostaglandins, which improve venous tone. You need a high-quality product standardized to 50 mg of esin. Take 300 mg of HCSE with your last small sip of water. Second, we use pycnogenol, which is pine bark extract. This is the support agent. Pycnogenol is an incredibly potent antioxidant that strengthens the collagen matrix around your blood vessels. It improves microcirculation and has powerful anti-inflammatory effects, working synergistically with HCSE. To repair and reinforce the entire vascular structure, take 100 mg of pycnogenol. Why take this at night? As your body enters its deep sleep cycles, it shifts into repair mode. By taking this powerful venotonic combination right before bed, you are flooding your system with the raw materials needed for vascular repair when the body is most receptive to healing. That is the definitive 7-step protocol. But before you get comfortable, I need to address the one major habit that instantly reverses all this circulatory work. You are probably doing it right now, crossing your legs. Whether you are sitting on the couch or lying on your side and wrapping one leg over the other, crossing your legs creates a physical clamp, a kink in the hose on the major femoral artery and vein. These vessels are responsible for returning all that blood and fluid back up. It immediately forces stagnation in the lower leg. Tonight, when you settle in, make a conscious effort to keep your feet flat and your legs parallel. If you are a side sleeper, use a thick body pillow placed between your knees. This keeps your knees, ankles, and hips aligned, ensuring the femoral vessels remain open and clear. Edema is fixable, and you now have the actionable nightly plan. Implement these 7 steps tonight. Do not wait. Please like, subscribe, and share this video with anyone suffering from swelling.